Across my career, I have admired the Brown School. It's a place where you can do your best work, driving evidence-based practice and changing this region and the world.
I don't think that there's been a more important time for institutions like the Brown School to be engaged in the type of work that we're doing.
And what we are trying to do is to come up with cutting-edge solution, new science, implement that in the real-world setting and find out what is working and take it to the scale and reach millions of households and improve their life.
Being a disparities researcher, I always joke with people and say that ultimately I like to be put out of business. I would love to not have to study disparities anymore. So that's the end goal, was to reduce and ultimately eliminate racial disparities in health.
One of the strengths of being here at the Brown School is the emphasis on intervention and turning our research into practice or policy.
You're seeing a school that's making a commitment to the idea of impact. And that impact in terms of impact factors, other metrics that we said we're doing well as scholars, but really trying to think about impact in terms of community and just growing into the ability to be willing to test itself.
Now we have to keep the pressure on ourselves and make sure that all of that discourse leads to real change. And that's why applied research, really putting students in the trenches and faculty, we need to stay engaged, but making sure that the people who need that information have it.
There's a lot of talk these days about the end of truth, and we don't believe that here at the Brown School. There are things that are true. There are things that are worth fighting for and worth doing. And we're committed to using the best available information, the best available evidence to try and make people's lives better. And I think that's needed now more than ever.